I'm Adrian Ghobrial. In recent days on City News, we've been sharing stories from patients who've had their medical procedures postponed due to a freezing of non-urgent surgeries by the provincial government. Now, today we have a positive development from a mother whose cancer surgery was canceled on multiple occasions.
Having my sister with this diagnosis, it's heartbreaking.
2 weeks ago, we introduced you to Michael. We're withholding his last name to protect his sister's privacy during this difficult time.
My sister was diagnosed with kidney cancer on January 13th. She received a call that the surgery was canceled due to lack of beds.
Last week, she was in hospital with an IV in her arm ready to go when her surgery was delayed again. This week, the family received some good news.
The great news, obviously, is my sister did receive the surgery yesterday, and it was successful.
On January 4th, the Ontario government directed hospitals to postpone all non-emergent procedures to open up hospital capacity for the surge of COVID patients. They've since lifted that mandate for some procedures at some hospitals, but not all.
There are people out there with significant suffering who have been delayed and delayed and delayed again because of these pandemic surges, overwhelmed capacity.
Dr. Fahad Razak is a member of the Ontario COVID-19 Science Advisory Table.
We have to prioritize getting people in as fast as possible now. And I would like to see that be a significant part of the reopening parameters we use. So as we are looking at other parts of society reopening, we have to also follow the ability of these surgeries and other procedures ramping up just as quickly.
Apparently having an open chest wound that could become infected is not considered an important surgery.
Sabrina Worrall received quadruple bypass surgery last January after the mother of two suffered a heart attack.
In February, the incision popped open because the sutures dissolved before it healed. So it was big enough that I could actually fit a pop can in my chest, which is not something I ever wanted to do personally.
Her appointments to have the open wound surgically sealed have been canceled by more than one hospital. She still doesn't have a date for the procedure.
What would you say to that family?
This has been very difficult for individuals and their families. Some have been waiting for a long period of time. But I would also say that if someone has a life-threatening condition, they will still be served right away.
I don't feel that's accurate at all. It is concerning about the thousands and thousands of other people and all the stories I've heard about them waiting for critical surgeries, life-saving surgeries that still need to be completed that are backlogged.
Michael adds that while his sister's road to recovery is just beginning, she is doing well. He also wanted to thank all of the medical staff and nurses across the province who are working during this difficult time. I'm Adrian Ghobrial for City News.